This podcast does not provide medical advice. Please listen to the complete disclosure at the end of the recording.
Hello, everyone, and welcome to Everyone Dies, the podcast. I'm Marianne Manso.
I'm Charlie Navarrete.
So please relax, get yourself some pie and a drink. And thank you for spending the next hour with Charlie and me. In the first half, we have our recipe of the week, and Charlie has an essay he's going to read to us. Second half, I'm going to be talking about COVID long haul. And the third half, we're going to be sharing an interview with a woman who had COVID, and she talks in detail about what she experienced while she was sick. So, Charles,
yes.
What is our recipe this week?
Our recipe is for funeral halva. Halva, which means sweet meat in Arabic, and recipes for halva vary across the Middle East, Central Asia, and India. Most versions appear in the form of a sweet, dense confection that's enjoyed year-round. But in Iran, Turkey, and Armenia, halva is also strongly associated with times of mourning. Typically, these groups eat halva as part of a memorial lunch known as a hoke-jash, which translates to soul meal. And you know, Marianne, speaking of soul, this year is the...
Are you going to do a soul... You going to do a soul train thing?
Oh, please, stop me, please. Don't make me do that. Don't make me do soul train. Listen, no. Nobody can voice soul train the way Cornelius could. Oh, what's his last name? Don Cornelius. Remember him? That voice. Oh my goodness, that voice. No, this is the 50th anniversary of Marvin Gaye's What's Going On. 50 years.
50 years?
Speaking of soul.
I'm feeling extremely old right now.
Oh, I'm not. It's just, God. No. Great.
Yeah, but like you remember when it came out, It's like, whoa. You gonna sing a little bit, or
no,
are we just moving on?
I don't think so. Mr. Gaye would probably roll over in his grave. So, going back to soul meal,
but with great syncopation.
Yes. So, on her blog, Turmeric and Saffron, Persian chef Azita Mehran describes the process of making and sharing funeral halva as both therapeutic and somewhat healing. Mehran's version includes rose water, itself a venerated funeral food that is sprinkled over graves.
So, for our first half this week, Charlie's going to read an excerpt from an essay published in the LA Times titled, "The Guy Who Collects the COVID Dead? It Was Carl," by Dr. Courtney Martin. The link to the full essay is posted on our webpage. Charlie?
I want to write about Carl. It's because Carl deserves to be noticed. Every hospital has a Carl. Carl is an all but invisible man. He works in the massive medical center's dispatch department, wheeling patients from hospital rooms to radiology for MRIs and CAT scans. He delivers specimens to labs, moves supplies and medications, transports blood and plasma. He has held the same job for the past 16 years. He is tall and thin with curly reddish hair and a sprinkling of freckles across his nose. He wears teal scrubs, the dispatch department uniform. He is 45 years old. He does not like attention. Due to the pandemic, Carl became the person who moved the dead bodies from the rooms, then took them to the morgue. Maybe this was a job before the pandemic, I'm not sure. And on the surface, this doesn't seem that bad. But in a pandemic, Carl became the body collector. Whenever I saw Carl, he had a lightness to him, always with a smile, soft eyes with small wrinkles and crow's feet, and an unassuming approach. He had a way of seeming seamlessly sliding on and off the unit with his morgue transport operation, while everyone else was hustling around. The phones were ringing, pagers going off, doors opening and closing, IV pumps beeping, ventilators oscillating. And then there was Carl, with a respectful smile, just quietly and efficiently moving bodies onto a metal gurney and then covering them with a black tarp. He said he was kept going during all of it because he felt when all the dust settled, the monitors turned off, the family left, the sheet pulled over the face of a former life, that someone needed to make sure they still got care. Someone needed to make sure they were put on the metal gurney nicely, arms positioned comfortably, feet and legs covered. Someone needed to take them down to the morgue with dignity and care. Someone needed to escort them, go with them. Someone needed to be their guardian. No, not someone. Carl.
Isn't that so touching?
It really is. And throughout the country, there are so many Carls. You know what people are called unsung heroes. But yeah, yeah. So it's just good to highlight one of thousands across America. So please go to our web page.
Thank you, Carl.
Yes, thank you, Carl. Please go to our webpage for a link for the recipe and additional resources for this program. We hope you will follow us on Facebook and Instagram, and remember to rate and review this podcast. As a nonprofit organization, we appreciate your donations to help us continue to offer no-cost education. Please go to our webpage to donate in support of our work, www.everyonedies.org. That's dies.org. Marianne?
Thanks for that, Charlie. So in our second half, we're going to talk about long-haul COVID. And, I really, thought that maybe we were done talking about COVID, and I was hoping we were done talking about COVID, but we're not done talking about
Silly
COVID.
girl.
Because, there's another surge going on, but also because there is this condition called long-haul COVID, which I want to share with you and let you know about in case you're not aware of it. The Centers for Disease Control and Prevention, the CDC, estimates that more than 114 million Americans have been infected with COVID-19 through March 2021. Now, we know we're recording this in August, so we know those numbers are even greater. Factoring in new infections in unvaccinated people, we can conservatively expect more than 15 million cases of long COVID resulting from this pandemic. And though data are still emerging, the average age of patients with long COVID is about 40, which is pretty young. And this means that the majority are really in their prime working years. Given these demographics, long COVID is likely to impact both our healthcare system in terms of people having chronic conditions, and they're young, so for a long period of time, and our economic recovery, because when you're 40, you're still working, but if you are disabled because of long COVID, you're not back in the workforce, you're not able to fill the jobs, you're not paying taxes and everything that goes with that. So there is an economic aspect to this long COVID. Most people who have COVID-19 recover completely within a few weeks. But some people, even those who've had mild versions of the disease, continue to experience symptoms after their initial recovery. These people sometimes describe themselves as long haulers, and the condition has been called post-COVID-19 syndrome or long COVID-19. They're generally considered to be the effects of COVID-19 that persist for more than 4 weeks after you've been diagnosed with COVID-19 virus. The whole cluster of long-term COVID symptoms has been named post-acute sequelae of COVID infection, or PASC. So those are terms that you might hear. You might hear PASC, you might hear long haul, long haulers. It's all the same thing. Research suggests that 50 to 80% of people who recover from COVID-19 experience at least some lingering after effects 3 months after the infection with the coronavirus. The numbers are higher in people who require hospitalization. The most common long-term symptoms include shortness of breath, fatigue, weakness, headaches, brain fog, which is like reduced attention or memory, anxiety, and depression. Additionally, there can be a cough, difficulty breathing, joint pain, chest pain, muscle pain or headache, fast pounding heartbeat, loss of smell or taste, anxiety, fever, dizziness when you stand up, and worsened symptoms after physical or mental activities. Now, you know, Charlie, that I can't talk about this stuff if I don't give some research as to what's going on, because, you know, it's like, it's not just what we think, it's like, what does science have to say? So we'll talk about 3 studies. There was a study published in June of this year in the Journal of Nature Medicine looking at 300 patients in Bergen, Norway. Almost all the patients diagnosed in the city during several months in 2020. 6 months after their initial diagnosis, 61% of the group had persistent symptoms. The most common problem was fatigue, followed by difficulty concentrating, disturbed smell or taste, memory trouble, and difficulty breathing. Many of the patients were younger. They were in the 16 to 30 age range. Initially, only had mild or a moderate case of COVID. The second study was published in February in the Journal of the American Medical Association Network by research at the University of Washington, which suggested that about 30% of COVID patients may experience ongoing problems that range in severity, such as fatigue, loss of taste or smell, and trouble breathing, at least 4 weeks after they no longer test positive for the infection. Some people report symptoms months later. And then in April, the U.S. Centers for Disease Control and Prevention Morbidity and Mortality weekly report found that 69% of non-hospitalized adult patients in Georgia had 1 or more outpatient visits 28 to 180 days after their diagnosis. And many of these people had symptoms potentially related to the original disease. Now, some of the categories of these problems, one falls into organ damage caused by COVID-19. So that's what we're talking about, is that there can be actual damage to the organs, which can cause real long-term problems. So although COVID-19 is seen as a disease that primarily affects the lungs, it can damage many other organs as well. This organ damage may increase the risk of long-term health problems. Organs that can be affected by COVID-19 include the heart. Imaging tests taken months after recovering from COVID-19 have shown lasting damage to the heart muscle, even in people who experienced only mild COVID-19 symptoms. They may increase the risk of heart failure or other heart complications in the future. Lungs. The type of pneumonia often associated with COVID-19 can cause long-standing damage to the tiny air sacs, those alveoli that we've talked about, those little balloons inside your body, inside your lungs. That results in scar tissue that can lead to long-term breathing problems. And then there's the brain. Even in young people, COVID-19 can cause strokes, seizures, and Guillain-Barré syndrome, which it's a condition which causes temporary paralysis. COVID-19 may also increase the risk of developing Parkinson's disease, and Alzheimer's disease. So the next area of damage are blood clots and blood vessel problems. COVID-19 can make blood cells more likely to clump up and form clots. When large clots can cause heart attacks and strokes, much of the heart damage caused by COVID-19 is believed to stem from very small clots that block the tiny blood vessels, the capillaries in the heart muscles. Other parts of the body affected by blood clots include the lungs, legs, liver, and kidneys. COVID-19 can also weaken blood vessels and cause them to leak, which contributes to potentially long-lasting problems with the liver and the kidneys. And I've heard people say, oh, I don't want to get the COVID vaccine because of the issues with blood clots. Well, it's sort of a damned if you do, damned if you don't situation, because either way, there is that potential for blood clot issues. The third area...
With blood clots, but I thought with blood clots, it was... I'm not trying to, just blow it off like it's nothing, but the possibility of that is minimal. I mean, it's a very small number of people or percentage of people, got blood clots. Is that right? Or, I mean, it's not.
Yeah, that's true. But people may choose to be concerned about small percentage possibilities and not maybe completely understand that getting the disease, even if it's mild, can cause problems for you for the rest of your life. So we'll kind of get to that in a minute. But just so that people will say, I've heard people say that, I'm not going to get that because I'm concerned about blood clots. Well, if you're concerned about blood clots, COVID long haulers, you can have that issue too. So the third area is problems with mood and fatigue. People who have severe symptoms of COVID-19 often must be treated in a hospital intensive care unit with mechanical assistance such as ventilators to breathe. Simply surviving this experience can make a person more likely to later develop post-traumatic stress syndrome, depression, and anxiety. Because it's difficult to predict long-term outcomes from the new COVID-19 virus, scientists are looking at the long-term effects seen in related viruses, such as the virus that caused severe acute respiratory syndrome, the SARS virus. Many people who have recovered from SARS have gone on to develop chronic fatigue syndrome, which is a complex disorder characterized by extreme fatigue that worsens with physical or mental activity, but doesn't improve with rest. The same could be true for people who have COVID-19. Many long-term COVID-19 effects are really still unknown because it hasn't been that long. We don't really know what's going to happen over time to people who've had COVID-19. And so the research is ongoing, and the research funding is just beginning, and COVID-19 long haulers clinics are just developing. Research recommends that doctors closely monitor people who have had COVID-19 to see how their organs are functioning after recovery. So, whenever we tell you about a disease or a problem, we always talk about, so what are you going to do about it? So with long haulers, what can you do? Well, first, preventing COVID-19 infection by receiving your vaccine is key to avoiding long COVID. It's always better to not have to treat something and avoid it than it is to try to treat it afterwards and kind of clean up the mess, right? Prevention is important. So if you don't want long haulers, get your vaccine. Healthcare practitioners recommend people with long-term effects try to get adequate sleep and exercise as much as their body will allow. We have a ton, an awful lot of resources on the webpage about exercises and support groups and all kinds of things that are developing for long haulers. So if you go to our webpage, it's all there. Many large medical centers are opening specialized clinics to provide care for people who have persistent symptoms or related diseases after they recover from COVID-19. Support groups are available as well. And they even have online support groups and that kind of thing. We have links for all of that. I really did a lot of research this week, Charlie.
Yes,
so
you did.
It's important to remember that... What?
Say, yes, you did.
Oh, thank you, Charles. It's important to remember that most people who have COVID-19 recover quickly. But the potentially long-lasting problems from COVID-19 make it even more important to reduce the spread of COVID-19 by following precautions. Now, I know none of you know what the precautions are, so let me tell you.
Please do.
Precautions include wearing a mask. Wear a mask. Social distancing. Avoiding crowds. Getting a vaccine. Keeping your hands clean. Prevention of a problem will trump treatment of a problem every time.
And speaking of wearing a mask, it's not just simply like cover your mouth. You got to cover your nose too.
Yeah, I think we talked about that way back at the beginning of COVID because the
it bears
virus
repeating.
lives
Yeah.
lives in the nose and that back of the throat area. So
Right.
covering your mouth keeps it from can be helpful. I mean, it's I guess better than nothing, but really you got to cover your nose because that's the
Yes, both.
That's the source. Because when they do the COVID test, they're putting that
Exactly.
swab up your nose and back into your brain there. So, have you ever had a COVID test, Charlie?
I have.
Isn't it like the worst thing?
I don't know. I guess the nurses that administered the swab, I guess they were all very gentle. I've had 3 of them, and I don't know. It wasn't that bad, but I have had friends say just that it's they shoved that thing too far up my nose. It hurt and all this sort of stuff, but and I say this with all sincerity. Many of my friends are wusses. So, I don't know. It didn't seem that bad. But no, I mean, but listen, nobody likes having anything shoved up their nose.
Today, we're going to talk with Nicole. Welcome, Nicole.
Hello.
Hi. Now, Nicole had the coronavirus. And yes. I know that there's still people out there who think that the coronavirus is a hoax and, you read Facebook, all the things that people think. And so we thought it would be a good idea to talk with somebody who's actually had the virus. Now, Nicole's a young woman. She's got young children. She's getting married on Saturday. And Nicole told me that she got the virus from her parents. And I kind of laughed when she told me that because usually, our kids sneeze all over us and give us every kind of nasty thing that we ever get. So I guess it's only fair, Nicole, that you got something from them. So tell me the story. What happened?
Well, we had been taking all of the precautions. I had been in Costa Rica the first week of March, and I came back into the country March 10th. So right as everything was starting to kind of shut down, and since from that date, I'm a therapist and did my private practice virtual. We pulled the kids out. We did everything we could do to be safe. We stayed home, and then end of May, beginning of June, there was a little dip in the numbers, and we had thought our parents were really missing the kids, and it was kind of like, well, we've been safe. They've been safe, although they had to work. And we had them here for my husband's birthday dinner, and we all got sick the next week. And it was, kind of shocking and scary. My dad got sick first, and then my husband got sick, and then my mom, and then me. And it pretty much happened within a few days of each other. We all got sick.
So Dad was the source of the virus then, I'm assuming?
We think it was him or my mom. They were both working, but my dad was symptomatic first.
And so what were your initial symptoms?
So my first symptom were my knees were hurting. And it was one of those things where I got out of bed in the morning and I was like, man, my knees hurt. Is this aging? Is this just what happens when you're almost 40? Or is this just a little bit more? And by that time, Cale, my husband, he had been kind of not feeling great. But then that day when my knees started hurting, he had felt better. And that was one thing about this virus is it comes kind of in waves.
Oh,
and so that was a Thursday. My knee started hurting. Friday, I was fine. Saturday, I was fine. I moved on Saturday. I had my friends help us move. Like, by that point, we didn't know. It had been a week since exposure. We did not know that we had it. On Saturday, when I was moving, my mom had went and got tested. And Sunday, I woke up and I felt like, oh no, either I have a terrible sinus infection or I'm getting sick. And as soon as I had that realization, my mom had gotten her test results back and called and told us that she was positive.
Oh my gosh.
And so that first day, I think being in Oklahoma, we all have sinus issues and allergy issues.
Yeah,
and the way that I could explain it was like the worst sinus infection pain without the congestion. And my voice just kind of changed and got very deep. And pretty much every hour after that, I deteriorated.
So what was happening?
It was so weird. Every day was it was like a different fiasco every day. It started with the face pain, and then it went to the body aches and just intense lethargy. And I was like, okay. And so we had to go get, we frantically went and got tested. And I will say, I had it way worse than my husband. And my mom, she's actually my stepmom, we call her name, she had it worse than my dad. It was different. I say worse because it's been longer. So the first day was very much I just didn't feel well. And then the next day, so that would be Monday, Tuesday, it was that saying, my fever never really got above 101. And I think I only had a fever the first 2 days. And it was Tuesday night, Wednesday morning when the headache set in. And it was debilitating. And I will say, when I was 21, I had encephalitis and I had to have a spinal tap. And this headache that I had during COVID was so reminiscent of having a spinal headache from a spinal tap, to the point where I called my friends that work in medical research. And I was like, is anyone doing research on spinal fluid and COVID? Because it was debilitating for about 4 days.
That
really
is way
bad.
Too long for that kind of headache.
It was really bad. And then it would come in waves. I feel like, and the headache would come in waves, and it was very, trying to think of a way to describe it, almost like I could pinpoint the spots in my head where it was. It wasn't all over. And so that was, for me, the most debilitating part, was just the headache. The pain was, I had to use my softest pillow, any amount of pressure on my face just could trigger it. It was really rough for a couple of days. And just, every day I would wake up and we would get out of bed at noon, just make sure the kids had sustained themselves and had breakfast and things were normal.
Gosh.
And I would feel okay for a couple of hours, and then I'd be down again. And then I would get up again around 7, try and feed the kids and be down again. Hale, my partner, he had flu A in March, and he said for him, flu A was worse.
Oh, really?
For me, I had it way worse than he did. He was sick for about 7 days, and I was in bed for a solid 10 days and did not really feel normal. Well, honestly, I just got my sense of smell back in the last few weeks, and I was sick in June. We
2 months of not being able to smell?
And I didn't even realize it until I got in bed the other day and I could smell him, and I was like, oh my God, I haven't smelled you in so long. I didn't even realize that it wasn't because it was coming back so slowly. But my sense of smell went away on day 3. Smell and taste. It was just, it was just different. My mom is still having a hard time. Like, thank goodness, none of us had to be hospitalized. But, my mom is still, like, she can't laugh without coughing. Her cough is still very, very prevalent. And I didn't even really get a cough. So one of the other things that I found super interesting is, like I said, I'm a therapist, so I always am kind of analyzing how we function. Is there is, I feel like, a cognitive impact, right, and an emotional. So we have the emotional part of, like, enhanced fear because we've been hearing about COVID and we're so scared about COVID and what does this mean? So that's already just kind of like there. Right. But I feel like there is an additional something in this virus, and I don't know if there's evidence to this other than just me talking to people that have had it, that it does something to the way you function emotionally, and definitely like a cognitive delay. There was many times I just could not, my brain could not process what was happening. It's just slow. And my husband will say that he feels like his anxiety, just baseline anxiety, has increased like 45% since having COVID. Really? And he's not an anxious person. He wasn't even that anxious about getting it necessarily and having it because he kind of expected that we would at some point. But it's just bizarre because it impacts everyone so differently in almost like every body system.
So the cognitive slowing, the cognitive delay you're talking about, are you talking about if somebody gives you a piece of information, you have to like chew on it a while before you get what they're talking about?
Yeah, and that, and also, so the example that I have is, and this was, I was on the road to recovery because I was in the living room, and we have a dog and a cat, and they cannot be in the same room. Okay. Dogs and cats. And so we keep them separate. And one of the girls had accidentally let the cat out. And there was this big ruckus, and like Kale had got up and got in the middle. And I just could not process what was happening. And by the time I got over, like one of the girls is bleeding from the cat scratching her. And the other girl's just standing there like mortified, like shaking because of the commotion, and it took me 5 minutes to understand what happened.
Wow.
Which
that
is
must
something
have
that
freaked you out.
It did, and I was just like, why is this happening? And I had called my parents to kind of just talk to them about it. And my mom just said that's the same thing, like someone will have to repeat something to her 3 or 4 times before she's like, okay, I understand what you're saying. It's just like the neural pathways are sludgy or slower. It's just interesting.
Has there been that you've read, since you've got that scientific mind, is there anything that you've read to explain why that would happen?
Honestly, I haven't. I will be really honest that I had to pretty much right after I got sick, I got off Facebook and I quit researching because there's just too much. There's too much, people believe it or they don't believe it. And it's just, I know people whose parents have died from COVID, and I have friends that, had to have emergency surgery as a result of COVID and all of these things. So I just had to eliminate myself from all of that and just kind of focus on my experience. I will say that my mom did a bunch of research and joined a lot of Facebook groups of people that have had it. And that seems to be one of the common symptoms that is happening, because she always gives me an update on like, I read this, can you believe this? This is exactly what I'm experiencing, and why aren't people talking about this?
And is there any sense of how long that sludginess goes on?
For me, I feel like it took several weeks to kind of be able to recognize what was happening. And like, I'm a processor, so I'm pretty quick processing. So I would say like probably 10 days post for me, like once I really started feeling better and being able to kind of function normally, and going back to work was really difficult just in my brain working and was challenging. It was just, there's just weird things. I booked us a vacation while I had COVID and had no recollection of doing it.
Oh, you're kidding.
No.
Wow.
We had talked about going on vacation and what that looked like, but apparently I researched that the Atlanta Aquarium was doing 50% capacity over 3 different reservation times and masks required, and I must have thought that was safe and bought us tickets to do that. Did not remember. So I got a reminder email. Weird things,
I sometimes say to my husband, did I just think that, or did I actually say, fill in the blank? And he'll say, yeah, you already said that, or no, you didn't say it. You must have just thought it. But and I didn't even have COVID, I don't think. So that's pretty weird.
Yeah, it was just, I must have thought it was fine in that moment. And, I'm really thankful that I had a friend who had a baby and was like, hey, you're suffering. I have medicine I can bring you. Because I would have went to the hospital, and that was what I did not want to do. I didn't want to take a bed away from someone who really needed it. And I didn't want to go, I was so scared about exposing myself to increased viral load and all of, I just didn't want to do that. I didn't want to be in a hospital by myself.
Right.
And so, I did everything I could to keep my fever down and manage my pain. There was that Wednesday night, that headache, I was really, really close to going to the emergency room.
Wow. Now, did you have any trouble breathing?
I really didn't, no. My parents did, and they went to the emergency room not because they were really, really struggling, but because they could tell that they were having a harder time maintaining their breath just sitting. And that even talking, they were getting out of breath just communicating. And so they couldn't get a hold of any physicians to, in that moment, to call them back, telehealth. And they ended up going to the emergency room just because I think that freaked them out.
Right. That's scary.
Yeah. And they ended up, getting steroids and antibiotics. And, my dad's lungs looked worse than my mom's. He's recovered a lot faster than her. And then, the whole emotional side of it.
Yeah. So are they coping with it differently within your family?
Emotionally, just how they live day to day? I think definitely. My mom's way more open and communicative in that way. And I think for my dad, I think it really freaked him out. Oh my God, am I going to die? Did I give it to my kids? Are my kids going to die? What is happening? And he just kind of shut down emotionally, I think, and just got really quiet. And I think he's been pretty quiet since then, pretty edgy even, I would say. Whereas my mom just wants to know everything. She wants to read all the things and stay on top of what symptoms she is still struggling to get rid of.
Now,
we had a talk the other day.
Oh, I'm sorry. Go ahead.
We had a talk the other day, and I was saying to her, I need you to go to the doctor, and I need you to get a full blood panel and run your all of my friends are nurses and nurse practitioners stuff. I need you to go get all of this stuff. We need to check your clotting factor. Have they done another x-ray of your lungs? Because she still sounds really terrible.
And is she functionally impaired? Is she able to walk and talk, or is she still short of breath?
She's not as functionally impaired. No, she's still working. She works in a physical therapy office, and she's functioning. It's just, if we are telling jokes or laughing or whatever, she will start coughing. It's almost like that asthma cough that happens when someone laughs really hard.
Yeah.
But it's been every time I've talked to her since June.
God, that's so annoying just as a symptom. Let
and just like
alone-
it hurting,
Yeah.
like coughing that much would be so painful for your muscles and skeletal systems.
Now, I was going to ask you, do you think your dad's reaction to it, and if I'm being too psyche, then you can, forgive me, but do you think him getting that kind of made him confront his own mortality? That has anything to do with his reaction?
100%. 100%.
Really?
He was very much like, we need to redo the wills. We need to be talking about, plans. Like, it really freaked him out in that way. And then there's the guilt. Like, I had guilt just because, oh my God, all of my friends were helping me move yesterday, and I wake up sick today.
Did any of them, I wanted to ask you, did any of them get sick?
They did not. And you know what else is
isn't that
interesting?
weird?
It's so bizarre. We had both of our daughters here, and we're a blended family, so we have joint custody with their other parents. And because I got sick when I had my daughter, the girls just stayed here. And they never got sick, thank goodness.
Yeah.
And we had them tested in July. One of them tested positive for antibodies, and the other one did not.
Wow.
And none of my friends, were positive, and they all got tested after I tested positive. I mean, we were moving and eating pizza and drinking beer, things you do when you're moving.
Right.
And we're not being as cautious. They're my best friends. They're like my sisters. And we had all been doing the same precautions, so we felt fairly safe. And then kind of the same thing that happened with me. But that guilt was just like, oh, my gosh, if I get one of them sick and then they get someone else sick, like I don't want to be responsible for killing someone.
Right.
I don't even want to be responsible for someone suffering with COVID and being sick, let alone like, oh, my God, like it could really mess you up.
Now, have you or your parents or your husband or your fiance noticed long-term kind of consequences from this disease?
I have not at this point. I don't think Kale has. My parents haven't told me anything with the exception of, my mom's not recovered fully yet.
Yeah.
One of our really good friends, though, he's my age, so he's 38. He was diagnosed with COVID, I think, the beginning of July and was hospitalized. They put him on IV antibiotic and the plasma with the antibodies, and then he was released. And then he was back in the hospital, I think like a week ago, and his liver enzymes were completely out of control, and he was having intense abdominal pain. And they went in and they said, like, COVID, they had to take his gallbladder, and they had to put him on a bunch of stuff for his liver, and they were just like, COVID just wiped out these organs. Like, it's just, the doctor told him, and I quote, you already had, like, your not really functioning organ, gallbladder, because we don't really use them that much, like COVID just took an already not functioning organ and just like annihilated it.
Wow. And so is he going to have chronic liver disease now?
I don't think we know yet.
Oh, okay.
It's just a matter of like, can we get his numbers stable? He was discharged. And he's just like a young guy like me. He's like, well, now I have to figure out what I can and can't eat. And it's just one of those things where you don't really think it's going to happen to you until it does. I remember early in this, he was very much like, no, it's not that big of a deal. And, he was still out there working, and he's a photographer. And then he was really, really sick,
And the thing that's really kind of scary, in addition, I mean, there's a lot of things that are scary about it, but that it seems to be so variable of, the 4 people in your family, and it's like, it's not like everybody has the same symptoms or the same timeline or the same anything.
Right.
It can be a blip on the screen or it can be death.
Right. And everything in between, which is just even, Kale, he did not ever really get a headache. Whereas I was, and I have a pretty high pain tolerance. Like, I had natural childbirth. It's like I can tolerate a certain amount of pain.
Yeah.
But it was debilitating for me, and he didn't really have that at all.
Wow.
So it just, I was having those nights that the headache was really bad, like thoughts that make no sense. And, trying
Do you
to
think
make
you were
sense of
delirious?
100%, yes.
Yeah.
And not from sleep deprivation and not from a high fever, because I was sleeping and my fever never got over like 101. And by the time the headache happened, I no longer really had a fever.
See, now those are symptoms that I haven't really heard talked about before.
Which part?
But that blinding kind of headache. So that's another one to add to the list. I wouldn't have really thought about that.
And one of the things that when after I got diagnosed, someone from epidemiology called me for the state, and they kind of track you. Mm-hmm. And one of the things that she had said is that it seems to be, there's all this seems to be, there's not really, everyone's doing studies, a correlation with where you have had previous injury, like that the virus just kind of goes there a little extra, maybe. And so, like for my dad, his shoulder really ached. His shoulders and his knees really, really ached, and he has bad shoulders and knees. So I was like hypothesizing, well, maybe it's because I had encephalitis and, I have migraines, that this is attacking that part. But this was worse than any migraine I've ever had.
So it's sort of like a weak link in the chain, and it attacked your vulnerable spots.
Maybe, yeah. And then she told me that the evidence is looking like you have, and this again was in the beginning of July probably when I talked to her, the epidemiologist, that it's looking like you have brief immunity. So like 3 to 4 months.
What, and how do they determine that?
I have no idea. She said that there are increasing cases of people getting it more than once.
Oh, gosh.
And so, that's how she said they're kind of determining that it's a shorter term immunity, kind of like the flu. You usually only get one type of flu once a year.
Right.
And, we ended up going
usually lasts longer than that.
Right. Well, yeah, that's just kind of what she told me, 3 to 4 months. We ended up going on the vacation that I booked in my COVID haze. And it was kind of one of these things, well, we can push it and then maybe not have immunity, or go with like science says that we have immunity right now. And, we took a road trip, and our daughters, I made them little like crossbody purses, and they had their masks in there, and they had hand sanitizer hanging on the side, and I even went and bought them a bunch of fake glasses that they could wear so they wouldn't touch their eyes. But it was kind of like, I don't know when we're going to get another vacation, and if we're safe, it's going to be right now.
Yeah, that's true, right? Yeah.
We did all these things. We postponed our wedding. We were originally supposed to have our big ceremony on May 2nd, and we canceled that. We ended up having a tiny little ceremony. But it was just one of these things where, like, well, if we're going to do it, how do we do it, and how do we do everything safely now in this new time that we're in?
And there's so many variables to think about that sometimes you can't even think of them all.
Right.
Yeah.
And then you have these conversations, like our daughters saw us be so sick and, been so worried about my parents. And now when we go out and they see someone not wearing a mask, they're like, why are they not wearing a mask? I'm like, I don't know. People get to make their own choices.
Even if they're bad choices, they get to make their own choices, right?
My dog the other day was like, well, should I go tell them that, like, you were sick? And I was like, no, you don't need to tell people. It's just it's a really weird thing. Like, I only know a few people really close to me that have gotten it, and all of them, even the younger ones, were like, this is way worse than I thought it was going to be. You know, I think Kale, my husband, is the only one who was like, the flu was worse for me. But him watching me, I think, freaked him out because it knocked me out. Like, I think one of the days my dad we would just FaceTime and kind of check in because you don't ever really know is this the day, like, someone's going to end up in the hospital? Because every day was so different. And my dad saw me on FaceTime, and I must have looked awful. He said, oh, my God, you look like shit. And he's like, oh, I'm so sorry. I didn't mean to say that. I'm so sorry that you're sick. But I think him looking at me and seeing how I looked and sounded, like, he was really upset and saddened that, they exposed us inadvertently.
Mm-hmm. Well, Nicole, that is an incredible story. And I'm so glad that you shared it with me and with our listeners.
Please stay tuned for the ongoing adventures of Everyone Dies, the series, the podcast,
Dun, 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 dun.
The Way of Life and Death. And thank you for listening. This is Charlie Navarrete, reminding you that the fear of death follows from the fear of life. A man who lives fully is prepared to die anytime.
Oh, and I'm Marian Mazza. I was thinking about your quote.
That's from Mark Twain.
And we will... he said some good stuff. And I'm Marian Mazza. We're going to see you in all the old familiar places. Remember, every day is a gift.
This podcast does not provide medical advice. All discussion on this podcast, such as treatments, dosages, outcomes, charts, patient profiles, advice, messages, and any other discussion are for informational purposes only and are not a substitute for professional medical advice or treatment. Always seek the advice of your primary care practitioner or other qualified health providers with any questions that you may have regarding your health. Never disregard professional medical advice or delay in seeking it because of something you have heard from this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Everyone Dies does not recommend or endorse any specific tests, practitioners, products, procedures, opinions, or other information that may be mentioned in this podcast. Reliance on any information provided in this podcast by persons appearing on this podcast at the invitation of Everyone Dies or by other members is solely at your own risk.